Once again for a new topic which we've tried to introduce, and we want people to get aware of it. And as you know, WeCare has been through the pandemic doing, trying to organize as many webinars as possible, as many knowledge streams as possible, so that we can learn more and take advantage of the fact that while we are at home, we come to know of various topics. So today, as we mentioned in our post and in our other social media information thing, that it's going to be all about blood donation, components of blood, and everything that you need to know about blood. So we have Dr. Sunil Rajadaksh, who is the head of hematology of blood donation in the Tata Memorial Hospital, along with his team. I would like Dr. Rajadaksh to introduce Dr. Anisha, Dr. Preeti, and Tejal before we can proceed. Thank you, Dr. Rajadaksh, and thank you, team, for being with us. You're on the mute, Doctor.
Yeah, sorry about that. Good afternoon, Vandana and the entire team. I'm Dr. Sunil Rajadaksha. I'm the professor and head of transfusion medicine at Tata Memorial. I have my departmental colleagues, Professor Dr. Preeti Desai and Assistant Professor Dr. Anisha Naukudkar, who is going to be making the presentation very shortly. So thank you on behalf of Tata Memorial for inviting all of us for this particular session. Thank you, Vandana.
So Dr. Anisha, may I request you to kindly do the presentation before we come to you with a lot of questions that we are all waiting to ask.
Sure. Thank you so much, Madam. Thank you for the kind introduction. And we are really grateful to Madam Vandana, Deepesh, Jyoti, and the entire WeCare team for taking up this campaign and helping us share the awareness on blood donation. So today I'll be speaking on the importance of blood donation and how the process of blood donation takes place in Tata Memorial Hospital. So as we all know, I am sure many of you must have been a part of the blood donation, either witnessed it for your family members, friends, or seen it at your residential complexes or corporate offices or in your colleges. So coming to the need for blood donation, according to the WHO criteria, if you see, or the WHO statistics, the nation's annual basic blood requirement is fulfilled by about 1% of the population donating blood. So if you see, today's India's population is around 1400 million. So to fulfill the blood requirement, about 14 million individuals should donate blood to make sure that all patients get the blood requirements are being fulfilled. And this data of WHO from 2008 to 2013, as you can see, the number of blood collected versus the number of blood required. So there is a huge mismatch between the requirement and the supply. And coming to the need of blood donation in TMH, Tata Memorial Hospital is one of the largest cancer centers in the nation. And each year, we get about more than 70,000 new cancer patient registration, apart from the one who comes for regular follow-up. And the hospital treats all the adult cancer patients, children, that is the pediatric patients with blood cancers, which includes leukemias, lymphomas, major surgeries, which are there for the solid tumors. And all this during the treatment process, they have a huge requirement of blood and blood components. As you must be knowing, patients from all over the country come to Tata Memorial Hospital to take treatment, and more than 80% of patients are from outside Mumbai. So either they come alone or just with one relative along with them during their entire treatment process. So therefore, we have to rely on our volunteers from Mumbai, and we are really grateful that the volunteers from Mumbai for their altruistic act of blood donation that have helped us maintain the blood inventory in our blood center for these needy patients. But there are times where we have faced challenges, especially during festive seasons or during vacation times. And as you can see, the annual statistics of TMH, each year more than about 20,000 blood units are collected. And from each unit, we can prepare about 2 to 3 blood components. So more than 50,000 blood components are utilized for our cancer patients each year. and the number is ever increasing. And therefore, we have to maintain the blood inventory to ensure that all patients' blood requirements are fulfilled. So therefore, we have moved towards 100% voluntary blood donation, which is also a global framework for action by the World Health Organization and also by the National Blood Transfusion Council of India. Now, I will take you to the basic eligibility criteria for the healthy blood donors. So we must be knowing that the age criteria is about 18 to 65 years. Here we must note that first-time donors should not be more than 60 years of age, while a donor who is a regular repeat donor can donate up to 65 years. The minimum weight is 45 kg. Minimum hemoglobin levels should be 12.5 gram per dl. Blood pressure should be in the range of 100/60 to 140/90. This can be with or without medications, but it has to be controlled. The interval between two blood donation for males is 3 months, while for females is 4 months. So if you fulfill this basic eligibility criteria, then you are one step towards the blood donation. Now, this is a short blood donation process which goes in our blood center as well as at the outdoor blood donation camps. So there are simple steps like registration of the blood donor, evaluation by the doctor, blood donation process, then post-donation rest and refreshment, and followed by certificate of appreciation. Now, this is how the registration area is there at the blood center of Tata Memorial Hospital. Our social workers are there to guide the donors. We have information pamphlets which provides the information about blood donation, and the donor is requested to fill up a donor card and questionnaire with their details to be filled in. If they have any queries, our social workers attend to them, and then they proceed for the weight and hemoglobin estimation. Once the hemoglobin and weight estimation is done, a mini health checkup or a medical evaluation by the doctor at the blood center is done, and small medical history is evaluated from the donor. Once the donor is eligible for blood donation, the donor proceeds to the donation area. And before blood donation, we request the donor to have some glasses of water and to be comfortable in the donor couch. So this is how the donor is comfortable at the donor couch. For each single donor, every time we use a single disposable sterile blood bags, which has a sterile needle attached to it. So this is one-time use. And there are blood collection monitors which collect fixed volume of blood from the donor. So that is about 350 ml or 450 ml, depending on the donor's body weight. So if you see, in any blood donors or an average adult has about 4 to 5 liters of blood. So the blood collected or the blood donated is not even the 10% of what is there in the body. Once the donation process is completed, the donor is requested to rest on the donor bed for some time, and the donor is provided with post-donation care information, after which the donor proceeds to the refreshment area. The donor has refreshments of coffee, biscuits, rests for a while, and we express our gratitude by providing certificate of appreciation to our donors with a reminder to them that yes, they are healthy and can donate after every 3 or 4 months as the time permits. So similar process goes on in outdoor blood donation camps, where we have in a single day, we collect about 100 to 150 units of blood at times. And during this pandemic time also, we have been ensuring that we take all utmost precautions for our donors by maintaining physical distancing, wearing masks, and use of hand sanitizers to ensure donor safety as well as the staff safety. So there are some points which we need to ensure before blood donation and after blood donation. So if we see, before blood donation, we ask the donor to have a well-balanced diet or food, avoid any fatty food, drink plenty of water, avoid consumption of alcohol, drugs, smoking, take adequate sleep before you come for blood donation, wear comfortable clothes because you will have to roll up your sleeves to lend your arm for donation, and do share your medical history honestly with the doctor so that they can evaluate you properly for blood donation. After blood donation, like I mentioned, one has to relax on the donor couch for some time. On that particular day, you need to have lots of liquids, that is water, juices. Avoid any strenuous activity on that day so you can resume your normal routine work. Remove the bandage only after 6 hours. And if there any discomfort, which is rarely seen, but if there is any discomfort, you can anytime reach out to us and contact the blood center. So despite this, there are some myths of blood donation, or there are some misconceptions which people have in their mind. So the people do feel that, does the blood donation makes us feel weak? So I would say no, because every 3 months one can donate blood. And even after blood donation, you can resume your normal activities after a short period of rest. People are scared of getting infections through blood donation is their thought. But I would say, like I mentioned, we use sterile disposable blood bags for each donor, so there is no chance of getting infection here. Women and girls feel that they cannot donate blood. No, except for a brief period of pregnancy, lactation, abortion, or during the menstruation. Apart from this, if they fulfill all the eligibility criteria, they can safely donate. And we do have many of our female donors who regularly donate blood. So people do feel sometimes that I'm too old to donate now. No, you can start anytime after the age of 18 and continue it till the age of 65. People feel that I need to save my blood when my family needs it. So let me tell you, you should donate blood right now, because there could be chances, if at all your family also needs it in future, there would be time that you might be in a temporary deferral period or might not be able to donate them. So better donate today, help the blood banks to maintain its blood inventory so that it is adequate for your family as well as for other patients. So these are certain myths or misconceptions which people feel, which are there, but the facts are put forth here. So what happens to the blood once it gets collected? Many a time people feel, okay, we donated blood, but what happens to the blood when we donate it? After that, what is done? So we transport it to our laboratory where blood undergoes processing, and the donor's blood samples are tested for mandatory tests and blood grouping, and the whole blood bag undergoes processing to be separated into different blood components. So from one whole blood, we prepare different components like packed red cells, platelets, plasma, which have different shelf life. So the red cells have a shelf life of about 5 to 6 weeks. Platelets just have a shelf life of 5 days, while plasma can be stored up to an year. So depending on what the requirement of the patient is, the particular blood component is given to the patient. So coming to the concept of platelet donation, I'm sure some of you have heard about platelet donation. This is just one slide which will depict the basic difference between blood and platelet donation. This is just to give you information. Like blood donation, I've been speaking for last 5-10 minutes that it is just a small procedure, about 10 to 15 minutes, the actual blood donation takes place, and it can take place anywhere. That means you can even donate blood in the blood center or at the outdoor blood donation camps. But platelet donation, like you see, in the platelet donation takes place in the hospital itself, because it has to be taken on a apheresis equipment where the donor is connected through a sterile disposable kit, and only the component which is required, that is platelets, is collected, and the rest of the blood is given back to the donor. So this procedure takes about 1 to 1.5 hours, and hence it has to be taken only in the hospital setting. Blood donation, you can donate anytime, but as I mentioned, the shelf life of platelets is just 5 days. We need to be sure of ensuring that platelets are collected according to the requirement. Blood can be donated every 3 or 4 months. Blood platelets, the single donor platelet donation, they can be done every 15 days, but not more than 24 times a year. As you can see here, this is one of a donor whom we felicitated just 2 weeks ago, and he has completed his 300 platelet donation just 2 weeks before. And I have to tell you this, that this donor has been a regular donor at TMH right from the day when we had installed our first equipment in blood center of Tata Memorial Hospital. Since then, he has been donating regularly till date. And he completed his 300 platelet donation just 2 weeks ago, and we felicitated him. So coming to the blood donation, as I mentioned, that from blood donation, we separate out components and we do prepare platelets. So that is called as random donor platelet. And from one whole blood bag donation, we get one random donor platelet. While from a single platelet donation by a donor, the amount of platelets which we get is equivalent to the platelets recovered from 6 to 8 whole blood donations. So that is the basic and main difference between the platelet donation and blood donation. Now, there will be certain times where you will be refrained from donating blood. So if you are sick on the day of donation, or you are taking some regular treatment for any illness, if you had jaundice, if you had some recent procedure or surgery, or you had some tattooing, body piercing, or at the risk of HIV or any sexually transmitted infection, you need to disclose this to the medical officer at the blood center. And those days we will refrain you from blood donation. But once you are okay, fine, yes, you can visit and consult the doctor and go ahead for the blood donation once eligible. This is to ensure that we collect safe blood so that we transfuse safe blood to the patients and ensure patient safety as well. Now, there are many articles which shows health benefits of giving blood. And as you see, some of them are listed out here, that blood donation reduces the risk of heart and liver diseases. It lowers the risk of cancer. It helps developing new blood cells. As you know, each time you donate blood, new cells are forming into your circulation. It lubricates your bone marrow, maintains body weight, lowers cholesterol level, and you get an immense satisfaction that, yes, you have saved somebody's life and improves your mental well-being. So you have given another chance for a human being to live. So it feels really great to donate blood or blood components. So don't wait for a call. Don't give excuses. Don't be afraid. Feel proud that you can save somebody's life. A few minutes of your time can be a lifetime for somebody. So you need not be a superhero, or you don't have to be even a doctor to save lives. It is safe, simple. Just donate blood. It will save lives. So we are really thankful to all our donors who have been donating at Tata Memorial Hospital or our blood donation camps and ensuring our blood inventory. So as you can see here, this is just a map of our Tata Memorial Hospital, and our blood center is very near to Dadar, or even at a walkable distance from Prabhadevi and Parel. And you can reach out to us anytime, whenever you get time. Please come and donate blood. Our contact persons are our social workers. They are there in the department, and we all will be happy to address your queries now. Thank you all.
Vandana, you're on mute, but can I come in for a moment here? Yeah, thank you. Thank you so much. Wonderful presentation, Anisha. Now, first, I felt like expressing gratitude to all the blood donors, platelet donors, the benefactors, the well-wishers, all the supporters like We Care. I remember We Care has been supporting this for decades. I joined about more than 30 years ago. And since then, We Care is, helping out patients for various things, including blood. An important point to note here is, for a hospital like Tata Memorial Hospital, which is a cancer hospital, even if you have the best of doctors, the best expertise, enough resources, blood is finally the limiting step, right? Because any kind of cancer treatment, the cells get destroyed, the cancer cells get destroyed, and with that, even the normal cells, whether it be RBCs or platelets or even the bone marrow, gets affected. So the need for cancer patients is much, much more than any other patient. And if anybody is interested in statistics, I would say that a super specialty hospital like, say, KEM next door, the requirement would be in the range of 12 to 15 units, blood units, per patient bed per year. So if there are, say, 2,000 bedded hospital, they would require about 30,000. But in Tata Memorial, the need is almost about 40. That's more than twice of a super specialty hospital. And if you consider the need for platelets, it's the entire Mumbai's requirement of platelets multiplied by 3. Thrice the entire rest of Mumbai's requirement is what a single cancer hospital like Tata Memorial's requirement is. So having said this, and Anisha has shown the gap between the demand and the supply, as I said before, blood can become the limiting step. If you don't have blood, the treatment might have to be stopped, because then the hemoglobin goes down, the platelets go down. I feel that, blood has been kept by God as a key. Today, you can even have test tube babies being made in the laboratory. You can even create humans in the laboratory. You can create different tissues from, say, embryonal stem cells, like cartilage, like liver, so many others. But blood, till today, you cannot make in the laboratory. It has to be given by somebody, by a human, because bone marrow is the factory for blood. And what the blood bank, or as it is now called blood center, does, it is just a medium that facilitates. You cannot transfuse blood the Amar Akbar Anthony way, take from one and give to the other by a tube. You need to take it, you need to process it, you need to store it properly in a storage condition, which is conducive to the blood because it contains living cells, the RBCs, the platelets, and make it available. Just to narrate an anecdote, I remember one of the most celebrated actresses of Bollywood in the 1980s. She had hemorrhage post-delivery. And there was an SOS sent out because that blood center in the South Mumbai hospital did not have plasma that was required. Plasma is required when the patient is bleeding and continuously bleeds. You need to stop the blood by clotting. 700 plus donors turned up. They were in the foyer of that South Mumbai hospital. Unfortunately, she could not be saved because obviously blood has to be taken, processed, plasma, and they lost 4 or 5 crucial hours. And she unfortunately passed away. So the point is that we need to make sure that blood is stocked properly so that it's available to a patient when required, right? So one has to give blood. So we keep telling everyone, please help us help you, so that any patient, any recipient who requires it gets it when he or she wants it. Now, this is just to add to what Anisha said to explain the ground situation. Thank you, Vandana.
Thank you very much. And I think some of my questions have already been answered in the presentation, but I have some more. One is that, you keep talking about healthy donors. So is there, like a criteria? I know you said the age and you said the hemoglobin. What about the weight and the sex and other things? Whether female, male, who's more acceptable? What should be the weight of the person? Is an overweight person allowed to donate blood besides the hemoglobin content? All of you are on mute.
So like I mentioned, the criteria remains same for both male and females. The minimum weight is 45 kg. So anywhere above 45 kg and a healthy donor, they can donate blood. Similarly, the minimum hemoglobin levels is 12.5 gram per dl. So irrespective, the criteria is not different for males or females. The criteria remains the same.
Okay. And for women also, it's a 3-month period, just like for male, or is it
so yes. So for females, the interval is 4 months, minimum 4-month interval between 2 blood donation. Unlike in males, it is 3-month interval.
Okay. And if she's pregnant, she can't donate, right?
Right.
And I just come in to add again here, just to say that about 2 years ago, these criteria or the rules were relaxed. There is an act called the Drugs and Cosmetic Act, which spells out the criteria for donation, who can, who cannot. And earlier, of course, the limit was 60 years of age, now it's 65. Like that, criteria have been changed. So earlier also the criteria for blood pressure, which is called hypertension or diabetes, also were different. And a lot of earlier donors keep telling other donors, oh, don't donate. They didn't take my blood because I had diabetes and I was taking, tablets or whatever anti-diabetic drugs. So the point to stress here is that the donor should defer himself or herself unless you don't fit in the broad criteria. You're 17 years old or your weight is not, adequate enough. So there's a doctor, a medical officer at the blood donation camp or wherever you donate, suppose you donate at the blood center, who would elicit your history in detail, evaluate you, examine you, and then decide based on the criteria. For example, if your blood pressure is controlled by taking antihypertensives, you can donate blood. Earlier, you could not donate blood, right? So leave it to the doctor at the blood center or the blood donation camp, their discretion to finally decide whether you can or cannot. And to also state that the interest of the donor as well as the patient is uppermost. So the doctor tells you, please don't donate for a particular medical reason. I think accept that, because very often donors do not reveal the history. They're so enthusiastic about donation, or some of them might be compelled also somewhere. So please reveal honestly your medical history to the doctor. It's in the interest of the donor himself or herself. Thank you.
Well, there are two questions which spring up from the answers that you've given me. That one is that, if the entire history is not revealed and somebody makes a donation, who would become responsible if some untoward incident was to happen for the donor?
Yeah, Dr. Anisha can take that.
Can you just mention the last part, what you said just now?
Suppose the donor has not revealed his entire medical history in his enthusiasm, and he comes and donates blood, and broadly he fits into the criteria, but there may be some other details which is not shared. So then something happens to the donor. So who becomes responsible for that type of situation?
Okay, so we have a questionnaire where the donor fills up the questionnaire, and there is something called as consent. The donor gives the consent that I have understood, I have voluntarily donating blood, and I have read the important points and have read the questionnaire, and I agree to this. So that implies that the donor is sick. If the donor has not given the history to the doctor will never come to know. And based on the donor's questionnaire, we'll be relying on those answers which the donor has revealed.
So you have somebody who's like a social worker or who's present while the form is being filled by the patient to make sure that everything comes in.
Right, by the donor, yes. So when the donor fills up the questionnaire and the card, if the donor faces any difficulty while understanding any concepts or any points, then our social workers or even the doctors are there to address those queries, so that they do not fill up any wrong information at the same time. They give up the right history for their own donor safety.
Okay. And Dr. Rajneesh, you mentioned that now people on diabetes treatment and on hypertension can also donate blood, right? With the controlled medicines and if they've been able to talk to. Now, but there are lots of cancer survivors and also now with a large number of population becoming COVID survivors. What would be the status for them?
No, we really admire the enthusiasm. In fact, cancer survivors are the first ones to come and say, now I have conquered cancer, I would like to donate. We understand their enthusiasm, admire them also. However, the criteria say that once you've had cancer, you cannot donate blood. And this is because you cannot be 100% sure that cancer has gone completely lurking somewhere or some kind of stress on the body. So again, as I said, this is in the interest of the donor himself or herself. What was your second question after that?
About COVID, now that almost everybody has been affected by COVID, what happens?
Right. So in COVID times, I think there were donors who were very special. Those who got COVID, call them COVID survivors, they could help others by giving convalescent plasma. But now there are other better treatments, and because of which, COVID convalescent plasma has fallen by the wayside. But COVID is no longer a deferral criterion, which means somebody who's had COVID, of course, there's a deferral period. It's about 14 days after somebody has had COVID that you can come and give. Even for vaccination, there's a period, but COVID does not defer you permanently for donation. And the criteria keep changing from time to time, depending on the kind of virus, etc. Even the vaccine. For different vaccines, it's different. In different countries, it is different. So we have to depend on the existing current criteria at the time of donation to decide. But the answer is yes. COVID does not, defer anybody, a donor, from donating blood.
And vaccination, 14 days after vaccination, you are saying one is entitled.
That's right. Earlier it was 28 days. Now it's cut down to 14 days.
Okay. And one more question on this is that, what about transsexuals? Are they allowed to donate blood? Do you take their blood or not?
Yes, Dr. Anisha can answer that.
Yeah. So with the current guidelines or from the Drug and Cosmetic Act, transgenders or high risk, they are called as high risk donors. So they are not allowed to donate blood as of now. So the guideline says no. So we don't know how it will turn out in future.
I just add to that saying some of the countries have started relaxing the guidelines, allowing transgenders to donate. But we as a country have to follow the national norms. And therefore, sometimes there are questions, like if you're starving, can you donate blood or not? Now, there are doctors themselves who come up and say, oh, it doesn't matter. I don't eat. I'm doing this particular type of diet. I eat at 11 o'clock and nothing before that. And nothing will happen to me. Now, obviously, when you have to follow the norms, you can't make some kind of considerations where you do not adhere to the norms. So as long as, these norms state currently that we cannot take them because they believe that it could be high risk, as Dr. Anisha said, we may not be able to take them.
Doctor, while we meet many patients who need blood, we ask the family to, donate it themselves. Of course, you already explained about the myth of infection and weakness and losing weight, because their thing is that, if I were to donate blood and if I become unwell, then who's going to take care of the family? And, for one person, can I risk my life? So would you like to say something about this phenomenon that people have when they are asked to donate blood?
So what I feel is so can I go ahead?
Yeah, please do.
So like I mentioned, if the patient's attendant, relative, if they are highly motivated, if they know that the concern of blood, the requirement of blood is always, if they're healthy, and if they come to the blood center, like I mentioned, these all myths can be taken care of. We can counsel them, we motivate them. It happens that at our blood center also, apart from whatever collections we do at the outdoor blood donation camps, patients' relatives, they do come even after treatment or during treatment, because they understand that, yes, blood can only be obtained when somebody else donates. So these myths or these misconceptions are taken care of once they come here, we counsel them, and yes, they understand, they're assured, and then they go ahead with the blood donation. So that confidence is given by us.
What I'm saying is from experience, there was this patient whose mother came to me and she wanted blood. And I said that, have you donated? And she said, no. I said, why? She said, because I have 3 other children and I cannot become unwell to be able to look after one child. And it was some, some counseling with her and talking with her to ensure that she goes to donate blood. And so I think, I don't know whether it's feasible, but whether it can be, like anybody who's getting treated at a hospital, at least we know we can control that the caregivers can be, spoken about, and a talk can be done about it so that they are all aware, and then maybe the requirement for blood to some extent may come down. I'm sure you've tried these things, but just a suggestion.
Right. Thank you.
I'll just come in here, Vandana, to say that, we want to aim at, along with Rakshak also, to make sure that no patient suffers for not getting blood. No one's treatment should suffer or stop. And though we have patients coming from all over India and even neighboring countries, it's difficult given the volumes of blood which are required for patients. So one is the patient's relatives are already stressed, and they have to run about, they have to harness resources from their finances, stay, everything, cost of living, the stress of the condition itself. So we want to make sure that blood does not add on to their woes, right? So compelling, coercing relatives is a no-no, a big no. At the same time, we have to assure that we have blood on the shelf to be able to give them. Right. And we are getting closer and closer with organizations like yours. But still, what happens is with cancer, there are different modalities that come up, newer technologies that come up. Even the treating oncologists get a little more ambitious to try out better treatments. And it's like, every time we try to press the tape is pulled away from it. So more and more blood or different kinds of components you keep on requiring. So it's a good idea to just motivate relatives, right? Not ask them to replace blood. We never do that at Tata. It's a good idea that there are so many patients, acquaintances, relatives, somebody coming to meet them, and they can always be told that blood is needed and would you like to donate blood? And what we try and do is let them have the experience of just watching how blood is donated. And it's because of deep-rooted myths like you're saying, I'll become weak. Somebody at home, a senior at home advises, no, now you're married, please don't give blood, kind of. So many myths which are associated with giving blood. But it's not to be done with force. If you tell that lady, no, you have to give, without which you won't get blood, she'll always carry that in her mind that I was forced to never probably ever donate in future. So what we need to probably do them is enlighten them, orient them, show them how it is done, talk to people who have given blood. And I think it's our failing if we haven't been able to assure that the donor's health is our responsibility. We would like to be safe by telling them, please don't donate blood, rather than saying, no, you have to donate.
Yeah.
Right. So very often it's donors who come and tell us, no, I'm okay, I can give blood, please take my blood. But yes, finally, it's a medical officer's responsibility also. Thank you.
I remember some time back, Dr. Rajadaksh and Dr. Anisha, there was a cricket match going on, and it was a day and night match. And by coincidence, we had organized a blood camp during that time, not realizing what the problem could be. And so many of the donors were rejected because they had watched the cricket match at night. So would you like to tell us more about this, like the timing and all that, because how many hours of sleep they need and things like that?
So Dr. Anisha, they were up watching the match. So it's not the cricket match that is the cause.
Now it's starting again. So that was my concern. IPL is starting again.
So it's sleep deprivation is what I think Vandana means.
Yeah.
So basically, this happens when people come and mention that they had a night shift, or they had a night shift duty, or they were awake last night for some of the other reasons, working in the offices. So we generally do not recommend people with inadequate sleep or inadequate rest to come ahead and donate. So a well night rested individual is good to go ahead for donation, because if you're not rested well, there are chances that donor might feel uncomfortable post donation, and that will put in a negative experience for the blood donation process. So well rested individual, a good night's sleep is what we generally ask before they donate blood.
So would it be like 8 hours or 10 hours or?
So anything between 6 to 8 hours. So minimum what we say is 6 hours, but undisturbed, well adequate sleep is what is needed.
Okay. And they must eat well before coming for donation.
So at least 4 hours prior to the donation, they should have had something, a light breakfast or lunch or something, but avoid having heavy fatty meals. So we don't recommend having any oily food stuff, samosas and vadas and everything like that. They just hog and come. So that is not good for blood donation.
Okay. The reason behind this is that if it's not according to your routine, if you sleep 8 hours and you have just slept 4 or 5 hours, or you generally eat in the morning and you have not eaten in the morning, there's some adjustment that the body has to do, and you can call it stress that the body already encounters. And on that, you donate blood, and that can be compounded. So this is just trying to take care that none of this, could affect the donor.
Yeah. So doctor, you had mentioned that it takes about 45 minutes to 1 hour for blood donation and about an hour and a half for plasma donation, right? So, but what is the entire process timing? Because, if I say it's just a matter of an hour, please come and donate blood. But when the donor actually comes, he finds he may have to spend a little longer time. So if you can tell us how much time should they keep aside while coming for the donation, whether it's plasma or whether it is for blood?
Okay. So for blood donation, the actual blood donation process, that the process of blood donation is just 10 to 15 minutes. But like you mentioned, right from the donor visits the department, from the registration, from filling up the form, questionnaire, getting evaluated by the doctor, then the actual donation, having refreshment, waiting for some time post-donation, this entire process takes about anywhere between 40 to 45 minutes. So for a safer side, they can keep an hour in a heavy day. If there are too many donors at the blood center, it might take an hour for them to complete the whole process, apart from the traveling time. So this is the time when I'm mentioning that they come to the department, start the process and leave the premises. So anywhere between 40 to 45 minutes, and on a busy day, maybe it takes an hour or so. That is for blood donation. For platelet donation, the entire process of platelet donation, the activity per se takes about 1 to 1.5 hours. So the donor has to ensure that 2 hours are there, it might be spent in the department itself. So they have to plan their timing, their travel time accordingly, that they come into the department. So for platelet donation, the only difference here is that platelet donation, these donors are already tested. So we give them an appointment. So all these donors are scheduled by appointment so that we don't waste much of their time. They come, they're scheduled, so they are already tested. They go ahead with the donation, which takes an hour or so, and post donation the refreshment is done, and then they leave the premises. So this is how the platelet donation takes place.
Vandana, there are one or two questions in the chat box. I might just take the liberty of passing them on to Dr. Anisha. The first is a specific question about diabetes. Can they or can they not donate? So which of the diabetics can donate?
So a while ago, sir also mentioned that diabetes people are either on the oral medication or controlled with the diet, or they are on insulin. So those individuals who is having diabetes, but the diabetes is well controlled with the diet and oral medication, and the drug dosage has not been changed in last 4 weeks. So they have been checking their levels, and if it is within the normal range, yes, they are very well okay to go ahead and donate. Of course, they have to convey it to the medical officer who is evaluating the donor. At the same time, if a donor with diabetes but on insulin injections, that donor is deferred. That donor cannot donate blood. So that is the difference which is there.
And there's one question about the form being multilingual. So whether it's a multilingual form or it's only in English or only in Hindi.
So we have blood donor questionnaires in English, Hindi, and Marathi, so that it takes care of most of our donors who wants to fill in particular languages. We have all these 3 languages available.
Just as Vandana is asking this question, I feel there's Google Translator now. And if we just put all these questions, because there are a lot of people coming from neighboring patients coming from neighboring countries, or even South Indian languages. They don't know Hindi, they don't know English. So I think we can just have a translation kept there in case they want to answer. Maybe we can't print questionnaires in all languages, but just as an interpreter would, I think we should take a step. Thank you, Vandana, for bouncing this question to Anisha, and we'll think on it and do something so that donors don't have difficulty. Thank you.
Thank you. Thank you very much. You have mentioned about a process when you put the patient on the machine in the hospital and you take out what is required and the rest of the blood goes back into the system, right? Now, I know there are many patients who feel that once the blood has come out, then there may be infection. And so the blood which is going inside the body may be infected and may infect them in the process. Would you like to talk a little about it?
So here what you mentioned is about particularly the platelet donation, where the donor is connected to the equipment through a sterile, disposable, closed kit. So it is a closed environment. Right from when the donor is connected to the equipment, the blood flows into the tubings. It's a closed, sterile environment which is not exposed to the environment. And the required components like platelets, they are extracted from the donor and the remaining blood goes back to the donor. So here, if you see the entire circuit, there is nowhere the donor's blood is in contact with the outside environment. So there are no chance of getting an infection. And that is how our donors have been donating regularly for so many years. Like I mentioned in our presentation, one of the donors, there are many donors, there are 14 donors who have donated more than 100 times in TMH platelet donation has been done.
So I think the clarification will help people, because that is one of the fears that they have. That, if something has been removed and then the blood goes back, then infection, and whether it will be, replenished with what has been removed, or whether we will have a deficiency of that later on and all that. So that is a huge concern that the patients or the relative, not the patients, the caregivers or the donors have.
And just to come into the picture about this, we've started doing this procedure called platelet where you remove platelets, and return the blood back. So every year on an average, we are doing about 4,000 procedures. And I would say in the last, about 27, 28 years, just multiply that by, at least about 3,000. And I would say we haven't heard of a single case of infection with this particular procedure, right? So, and that's the reason. The reason for that is we are using a disposable kit, the cost of which is very exorbitant, I should say. It costs in the range of about 8,000 to 9,000 rupees just to make platelets, just the consumable. And this is to ensure, again, donor safety, and there's no chance of infection at all.
So Dr. Rajadek, since you brought about this thing about cost, does the donor at any stage have to pay anything, or it is only just his blood or his components
No,
that he's given?
the donor, of course, is an angel and gives blood or platelets. So the donor does not have to pay except his time, a few minutes of, the donor's time, and we say it could mean a lifetime for somebody else. So the donor would spend time to commute, right, to say sit on the machine here and to go back, and that's all that I think he would spend. As far as the cost of processing blood, I would call it bottling of the blood, right? So if you're taking blood from a donor, you can't do it the Amar Akbar Anthony style by, attaching a tube and sending it. You need to take it into a blood bag, then do several tests, HIV, hepatitis B, hepatitis C, syphilis, malaria. Then when you have to give blood, you have to do cross-matching. You have to store the blood. So the establishment costs, staff salaries. So in short, there's a processing cost, as we call it, just to bottle the blood. And not everything is passed on to the patient. The Ministry of Health and Family Welfare has set a ceiling on what can be charged to the patient. And in Tata, of course, most of the costs are subsidized for the patient. But yes, there's a cost for processing the blood. It is not the price of blood. Very often somebody says, oh, I paid so much to get blood from XYZ blood center. They charge me 1,050 rupees. Now that is not for the blood. The blood is given free by the donor. It's only the processing cost that is charged.
Okay, so one thing that comes out is like, suppose I may have donated not in Tata Memorial, but somewhere else. And I get a card saying that I can take that blood whenever I want to for myself, for my relative. But if a need arises, then Tata Hospital normally does not accept blood which has been processed outside. So if I bring a bag of blood from outside and give it here, it's not accepted. Is there a reason for it? Would you like to clarify?
I would beg to differ on this statement. It's not accepted. First thing is that we try and ensure that every patient gets blood of every possible group or every blood component that the patient requires. In times where certain groups are short or certain situations like the COVID pandemic, so when you talk of blood shortage also, it's like it's not across all groups or across all components. But sometimes the RH negative groups, which are a smaller percentage of donors, and the need is more, you might have situations where you don't have blood. In which case, Tata, of course, accepts blood from outside. The only thing is it is regulated. You do not get it from anywhere and everywhere, right? So there are certain blood banks, and of course, there's a Federation of Bombay Blood Banks in Mumbai, which has at least about 50 blood centers or blood banks as members. And they include all private, charitable hospitals, trust hospitals, municipal hospitals, government hospitals. So there's a good network where each one knows the other standards so that you are sure about what blood is coming in. And to tell you, yes, every month we have about 20 to 50 units which keep coming outside when we don't have that particular group. So it's not correct to say that we don't accept from outside. The only thing is we ensure that it is brought from a blood center that is accepted, and we take it on stock, we cross match, and then give it to the patient.
Okay. Thank you for that clarification, because very often, this question comes up and people are unsure of why the difference that if I've given to a blood bank, which I thought was reliable, and I bring that blood from there.
The other thing is, sorry to interrupt you, but the other thing you said is card, and that is what really, brings us to opens another topic, and that is about donors, if at all they expect anything after they donate. So the question often comes in, what will I get if I donate? Right. So when you talk about that donation, you're just giving it away, whether in kind or cash or whatever, and generally forget about it, right? Because that's an act of altruism you've done. But very often when it comes to blood, it's like, what do I get if I donate blood? Right. So this card system, which is of course being followed at several places or in several states, is creating depositors. So you get 1, 2, 5, 10, you accumulate 10, 20 cards. And then, sometimes, obviously, when the blood center doesn't have blood, we call it slack season, when there are vacations, hardly any camps anywhere, all these cards come out, they surface. And everyone goes to every blood bank saying, I've donated so many times. What is the use if I cannot get blood when I need it? Right? So blood is, you can call it a perishable commodity with a finite shelf life. And therefore, we have done away with the system of cards, at least at the federation level. And we don't ever ask any patient to replace number one unless its blood is very short. And of course, never ask for a card. Even if a donor gets a card saying, I have a card, we tell them you'll get blood, don't worry. Right? Only in case it has to be brought from outside for some reason, then we might ask you to come over and get blood on basis of that card, if at all.
Two questions. One is, you mentioned about people having tattoo and they can tattooed themselves and they can't donate blood. So is it forever or is it only for a certain period that somebody who has a tattoo cannot donate blood?
So it is called a temporary deferral, for it is for a certain period of 12 months. Like from the day of tattooing, 12-month deferral is there. So same is for the body piercing also. So if they have done ear piercing, nose piercing, or tattooing, so 12-month deferral is there till they can be eligible for blood donation.
We just hope that the donors give a proper history and say they did it 12 months ago or 6 months ago, and not say I've done it 5 years ago when they've done it recently. So again, we have to rely on the donor history.
Yeah. You mentioned that, you may not, when blood comes to you, you test it out for the various diseases like hepatitis or syphilis or other things. Now, suppose there is a donor whose blood has been found to have these problems. Would you inform the donor about it or would you not say anything?
Okay. So in the donor consent, in the donor questionnaire, we have a point where it mentions that would you like to be known about your test results or clarification of the results. So we ask the donor whether they would want to know about these things. If the donor consents for it, if they say yes, then yes, we do call them in the blood center, counsel them, and go ahead with the further procedure, like following them up with the referral centers and all. But if the donor do not consent to be asked for the clarification or to be known about the test results, then we do not call. So this depends on the donor consent, whether they want to know or they don't want to know.
Okay.
Just like to supplement that, Vandana, if you may allow, is if the donor says yes, of course, they would be willing. We also tell what we do in case they're found positive or reactive. So in case they were to be found HIV reactive, obviously, of course, they're called to the blood bank and we tell them what exactly is the plan of action. Later on, they'll be referred to some the ICTC, as we call it, a referral center, integrated counseling and testing center, which is usually in municipal hospitals or even in private hospitals. So they would test the blood there again, right? If they turn out to be hepatitis B or hepatitis C positive, they are referred to a gastroenterologist. So in case it is Tata, then you would refer to KEM, Department of Gastroenterology. So they have to know it's not just about knowing who is positive or not, but after knowing positive, what is to be done. Similarly, if somebody's hemoglobin is not adequate, during donation, somebody's hemoglobin is, let's say, less than 12.5. We don't leave them saying, oh, we can't take your blood and try after some months. But I think what is necessary is counseling, telling them what to do, how to do they need a checkup, how to follow up, and how it's only a temporary deferral, and they can always come back later and donate if their hemoglobin is found to be okay.
Thank you, Dr. Rajneesh, and thank you, Dr. Anisha. I think a lot of clarification on many things have been done. I mean, I have myself become very much more educated than what I was about blood donation. So thanks a lot to all of you. We have a proposal and I would request Dipesh to talk about it. Dipesh is our communication person in WeCare and he wants to take it forward. So Dipesh, all yours.
Thank you, Vandanaji, for giving this opportunity for me to share this proposal with the team and everybody listening to this conversation. First of all, I would like to also thank Dr. Rajadaksha, Dr. Anisha, and the entire team of Tata Hospital. These guys have been doing phenomenal work in saving so many lives. And for so many years, I've been knowing about Dr. Rajadaksha for a very long time. And I have only heard so many good things about him that I cannot even start right now because it'll take another 1 hour to talk about him. So thank you very much once again for taking us through the entire process of blood donation, the importance of blood donation. And it is so important and in today's time that we are self-aware, we understand what is good for us, and learn to do good, not just by going out and doing more intense kind of development work, but also something as simple as going and donating blood, and you save so many lives, you do so many good, not just for others around you, but also to yourself, to this beautiful life that we have got as human. So taking this entire discussion further, and I would like to propose a campaign that will help the doctors at Tata Hospital and eventually the patients. And let me present to you the campaign Rakshak. The objective of Rakshak is to support people who come for medical help, and through Tata Hospital, every time there is a shortage of blood, we get a call from doctors at Tata Hospital to help them fulfill the requirement. And the phase 1 of Rakshak is going to be to collect the database of people who are also prominently living around Tata Hospital, where they can easily go to the hospital, donate blood, and come back and do their regular jobs. And the whole objective is to only encourage the culture of donating blood, at the same time helping people who come for medical help. I was just last time when I visited Tata Hospital, I went and donated blood. I spoke to some family members there whose one of their loved ones was getting treated at Tata Hospital, and I can understand the anxiety of people who are in a completely new place. And how do you think they would go about finding it? And as a citizen of this beautiful Amchi, Mumbai, I think it's our moral responsibility to support anybody and everybody who comes to our city for help. And yes, Rakshak is going to do that. And I'm really proud to be associated and taking this initiative further. We Care as an organization, we are a 28-year-old organization working in this sector of cancer care, supporting people with compassion and kindness in every possible way. And Tata is one of our strongest ally in fight against cancer. So thank you very much once again, Dr. Anisha, Dr. Rajadakshak, for giving us this opportunity to do service to the nation, to the people in the most beautiful way. So thank you once again, and I would like to end my talk on this note. I would also like to take this, invite our COO, Ms. Jyoti Patil Shah, for giving a Thanksgiving note. But yes, Vannaji, up to you.
Yeah, what I was saying is that now we urge everybody to be a blood donor and to register yourself. Soon it will be on our website. And if you register there, we'll be happy to take you on. And we don't want to treat you as a mere blood donor. We want you to be very, very special for us and for our donors, for our people who are going to receive the donation. So each one of you who registers is going to be extremely special. And each one of you who is going to be a blood donor will really make a big change in our lives and in our patients' lives. So that was my request. Jyoti, please, may I request you to do the vote of thanks?
Yeah. Thank you, Dr. Rajadakshak, Dr. Anisha, the entire team at Tata Memorial. We all look forward to getting this whole initiative kick off and do our best in whatever we can. It is really nice of Dr. Anisha to say that don't be a superhuman to be a donor. But yeah, I could say yes, let's just be human and do the needful that needs to be done. So I guess, we all have to be limitless and just go ahead and donate blood is the message that we have to, give across. Thank you very much for this. And we look forward to working with you and the team there. And yes, let's make Rakshak one of the most crazy initiative that we need to just carry forward. Thank you so much.